everyone, welcome to Flexibility Script. This video is going to be covering things to help your calf and your ankle specifically, using a band for banded movement mobilizations. Some of these mobilizations can be found in the book Release Your Flexibility Potential, and if you have the book, it's available on Amazon through ebook and paperback. If you have the book, it's on page 97. This is what some of the mobilizations will be doing look like to kind of clear any impingements that could be felt in the front of the ankle that can restrict range of motion to your foot and ankle and lower leg. And usually any issues with the foot and ankle usually ends up having a way of traveling up the chain, and something in your hip or knee or back can end up compensating for lack of mobility in the ankle joint area. So these mobilizations, there's two of them, are really easy to do and just require the use of something like a pull-up band. These bands, I should say, come in different sizes, and depending on what your inherited flexibility is, kind of determines the size of the band that would be best for you to use. And all of that type of information is covered in the book, along with I have a video that goes into what size band is best for you to use. So I'll be using the Cobalt band today, made by Rubber Bandits, and this has about 30 to 50 pounds of tension. And it's going to be looped around my ankle joint. So for this mobilization, I'll be using the door hinge as my anchor point to be able to anchor the band. And there's something called a door anchor, a Theraloop door anchor, and you just see just as so, and it kind of helps secure the band in place if I don't have anything to anchor it to. So what I'll do is I'll take that anchor, and I'll usually will take the band and place the band right through, and then from there, this end is an end that goes in the door hinge. So I'll just take that and I'll loop it through until the band is just as so, and then this is the part that's going to be anchored into the door hinge side of the door, and I'll close the door and it'll secure it. For this mobilization, since I'm dealing with the foot and ankle, it's best to position the band on the lower side of the door, so it's closer to my ankle. So I'm just going to stand up and just set that up. So, open the door. I'll insert the anchor in, and then I close the door. And then once it's in, that the band is nice and secure. So for this mobilization, since we're talking about ankle flexibility, sometimes it's kind of sometimes you'll have tension and tightness, shortness in your lower leg musculature in your calves, or maybe you're a runner or you participate in sports where you're utilizing that lower leg musculature more to push off more than if you were participating in a walking program, though that could benefit from this too. But when you're dealing with that, sometimes you'll feel that stiffness and range of motion both in the calf and in your heel cord, in the so the back of the the back of the ankle. So sometimes there's this little thing I like to do where if I take both feet, bring them together, and if I just kind of dip and bend at my knees, usually we'll see when you look down, if one ankle has a little bit more range, you'll see that that knee travels more slightly forward than the one that doesn't. Sometimes they're equal. In my case, I know it may be hard to see, but I line my feet up, my right knee comes forward more than my left knee. This is my right knee, this is my left knee. So my left leg is the one that I will be working on today to do these mobilizations. So there's a couple of variations. The two that I'm covering today are the most simplest ones that you can do on your own. The variations that can be done is sometimes you can put like a a weight underneath your foot to elevate your foot, almost like this calf stretch integrated into it. You can also add something like a floss compression band, a Voodoo floss band, to your calf and integrate that mobilization of the tissues into this ankle mobilization. The two things that we're going to be doing is we're going to be addressing the front of the ankle, and we're going to be addressing behind the ankle. So when you address the front of the ankle, it really helps with clearing out any restrictions that sometimes you'll go into trying to bring that knee forward, that you feel you actually can't move any more forward because it feels like there's a block or just a bone feeling that doesn't allow you to actually move forward. And that's where the band comes in to help clear those impingements in the joint capsules. The other mobilization comes from the back of the band will come to the back of the foot, back of the ankle and the heel cord area, and it's a really nice one to help restore freedom of motion back into all those tissues back there and help the ankle move forward more. They are both beneficial, and some people just like one more than the other. So to do this first one, I'm going to start with clearing the front of the ankle. I'm just going to be taking the band. I'm going to take that band and I'm going to be placing it right at the base of the foot and ankle here. So one of the things I want to make sure is that it's not directly on my tibia, on this shin bone, that it's actually kind of right at that base where if you find both of your ankle bones, that band is kind of going around it or slightly below it. And so if I have the tongue of my sneaker here, I kind of place it so it's kind of right in that place there around the tongue of the shoe. So from here, once I have it, I'm going to just be walking forward into tension. And when I walk forward into tension, I'll come forward, and then that leg that's not in the band will be my forward leg. I'm going to position the camera so that you just kind of get a sneak peek at my lower leg as I go into this mobilization. All right, so you won't see me, but you'll see my leg. So coming down, there is the band, and then I'm coming forward. Once I come forward, my main action here is the leg that's not in the band is forward, the leg that's in the band is behind. All I'm going to be doing is I'm going to be dipping that knee forward and coming back. Knee dip forward and back. From a side view, it's this motion here that I'm going to be going after. So the little dip of the knee forward, little back. I'm actually going to do it from here. So I'm there and then dip and then right back. Dip the knee back. And the tendency sometimes is not to really move forward, but to more do this, where you're sitting into your hip. And that does get some movement at the knee and ankle, but really see if you can focus in on just driving that knee forward and coming back. Knee forward and back. So when I stay there for maybe about a minute, sometimes I count repetitions, like maybe 20 to 30 reps, where I'm just driving forward and back. From a forward view, again, it's really important that as I oscillate in and out of tension, that I don't let this knee fall inward. Almost think about keeping this knee in line with the foot or slightly out, the way it would kind of translate when you're going into squats. So from there, if I wanted to be more comfortable, I can come down into the ground and I can do the same thing, except for a more seated position. So I'll come forward into tension. This time my banded leg is the forward leg, and then the leg that's not in the band is back behind me. So right there I feel tension, so all I'm going to be doing is I'm driving forward and back. And just this little oscillating in and out of tension is really what the mobilizations are about. It's called paper clipping. So if you can think of like a steel paper clip and how much you can like take that paper clip and start bending it forward and back. And as you keep oscillating in and out of tension, that paper clip starts having some give. That's kind of like what we're doing to our ankle joint. So also, if you wanted to, you can do upright and then come down below and have this feeling where you're able to kind of shift your weight more forward and use your hands to be able to push that knee forward into improving ankle range of motion. This band here will gently distract and create like this this anchor point for the ankle, whereas you drive forward, this tension in the band is helping to mobilize and move the ankle back, allowing you to restore that freedom of motion and clear that impingement that can be felt at that ankle joint. So there's part one. Part two looks very similar, where you could do it standing or come down towards the ground, except that we're going to address the heel cord. So to come out of this, we'll come out all the way, and the band is going to be positioned same area. So if you find the ankle bones, the lateral and medial malleolus, if you find them, the band's going to be placed around them on the back side. So it looks like I'm going to step, and I'll take that band and I'll place it right around them. Hopefully you can see that all right. From here, again, you're not going to see me here in a second. I'm going to stand up and I'm going to walk back, and I'll try to capture the best views possible. So from here, I'll stand. And then from here, same as the first one, where the not banded leg is going to be my forward leg, the leg that's in the band is going to be my back leg. So I'll walk back to tension, and then once I'm there, same thing. I'm just going to think about dip that knee forward and back. If I wanted to, my hands can go up against the wall to kind of help support me, and again, dip the knee forward and back. So I walk back to create that tension in the band, and I'm just dipping forward and back. Same thing, 1 or 2 minutes. Usually as you keep going, you'll feel a change and you'll feel more ease in the movement. From here, I can also do the same thing I did before, except I can come down to the ground. So when I stand, the leg that's not in the band is forward. When I come down to the ground, that leg is going to be my back leg. I'm going to just readjust the camera one more time just to capture more of this side view here. So, they come down, band around the ankle, and then I'll come back to tension. Once I feel that band is lightly pulling me, I'm just going to be again driving forward and back. I can come with my body driving, helping it drive forward and coming back out of it. I can also just be not using my hands, where I just kind of just keep letting the band take me forward, come back, forward and back, or use my hands to allow a little bit more. If I wanted more tension, I just shoot that foot back, and then same thing, where I'm really working on coming back and driving forward. And that's it. So a lot of these mobilizations really just use that paper clipping method, where you're just oscillating in and out of tension continuously, and then we're coming from the forward part of the ankle and the back part of the ankle. And usually when you're all done, when you walk around, you'll feel like your foot is a lot lighter. You'll feel like a difference in your range of motion in just your whole ankle and lower leg. And if you were to retest, usually we'll find that that ankle, when you bring both knees forward, that ankle, that knee that wasn't coming forward well, is now in line with the other one. And this translates into things like pistol squats or single leg squats, or squats in general, really. Having good ankle range of motion really allows you to be able to sink down with your hips and make sure that you're not compensating with your back. So give this a shot. I may reshoot this in the future, so I think this would maybe greatly benefit from someone else recording it so that I don't have to reposition the camera, and I'll try to reshoot it with a floss compression band integration as well. So hope this helps. Bye.